Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. With the Omicron variant on the rise and ongoing changes in public health guidance as the science evolves, it's not surprising that many have questions about what we can all do to help stop the spread of COVID-19. With me today is NFID Medical Director, Dr. William Schaffner, to help us understand the current guidance. Thanks for joining us, Bill. It's always a pleasure to have you.
Always good to be with you, Marla, to keep up with what's happening on COVID. And there's always something happening with COVID.
Never a dull moment indeed. So, Bill, let's start with the COVID-19 vaccine booster doses, of which there's been a lot of news lately. So, at a high level, Bill, who should receive a booster dose and why these changes in the recommendations?
Well, booster doses are recommended for everyone who's eligible. They're really important because it's been shown that after the initial vaccination series, if you've taken the booster, you should actually think of it as a complete vaccination series. That's your best protection against this new Omicron variant. It really helps protect against the development of more serious disease, helps keep you out of the hospital. The two major changes that have occurred are, first, that boosters are now recommended for children age 12 and up. So everybody 12 and up is now eligible for boosters. And the reason that new recommendation came in is because, as always, new data were available. The boosting was studied in these young children, shown to be not only safe, but effective. The FDA gave that approval, and so did the CDC. The other change is, we used to say with the mRNA vaccines, Pfizer and Moderna, if you wait for 6 months after your second dose, you're then eligible for the booster. With the Pfizer vaccine, it's now 5 months. So just wait 5 months and you can get your booster. Once again, the data show you don't have to wait 6 months in order to get that benefit. So boosting should now be very, very comprehensive.
Great. Shifting a bit on to masking now. The guidance on masking has changed many times over the course of the pandemic. So when should people wear masks and why?
Well, the why is because Omicron is so extraordinarily contagious, and it can spread not only to people who are unvaccinated, where it can cause more serious disease, but also spread to people who are vaccinated even though they've had a booster. But they'll get mild infections, but they could acquire the infection and or transmit it to others. So the CDC recommendations continue to be, whether you're vaccinated or not, if you're out of your home and indoors, especially if you're indoors in a group activity, no matter what the reason for the group activity, please wear a mask to protect yourself as well as protecting others. So masking continues to be, along with vaccination, fundamental to helping to control the spread of Omicron and other COVID variants. Now, the question has come up and it's been much discussed. Which mask? I'm going to say this several times. It's important to wear a mask and to wear it appropriately. That is, over both the mouth and the nose. We see many people wearing masks below the nose. That does not count. Now, which mask? Basically, we have three kinds: the surgical mask, the cloth mask, and the N95 mask or respirator. Please wear one of them. The surgical masks are easy to acquire, inexpensive, work pretty well. There's been a lot of discussion about whether we ought to be wearing cloth masks, and there are a lot of experts who, in the context of Omicron, are critical of the effectiveness of the cloth masks. The CDC doesn't say you ought not to wear them. If you do wear them, make sure that they are of several layers, at least 2, 3 preferably, and that they fit snugly around your face. Now, the third kind of mask are the N95 respirators. They're clearly, if worn correctly, the most effective. They fit most tightly around your nose, your cheeks, and your chin. If you put them on and fit check to make sure that they're well sealed, the first thing you will discover is that the work of breathing, just simple breathing in and out, is much more difficult. That's because you're essentially breathing 95% of the time entirely through the filter that's in the mask. That is strenuous for many people, particularly for a long period of time. Also, with the tightness of that respirator, that N95, some people get skin irritation, just noting. And those chaps who have beards will find that the N95s don't fit completely. That's just inherent in the difficulty of fitting an N95 if you've got facial hair. So choose one. I'm sure masking is under constant review by the CDC, but at the moment, choose one, wear it well. Better to mask with any mask than not wear a mask at all.
Perfectly succinct. Thank you. So, Bill, the Centers for Disease Control and Prevention, or CDC, recently updated the guidance on quarantining. So can you help us understand the new guidance and the reasons for these changes?
The reasons for the change, Marla, were 2. First, there was genuinely accumulating scientific evidence that you are most infectious for a day or sometimes 2 days before you become ill, and for the first, second, and sometimes the third day after you become ill. So that's the critical time when you're hazardous to other people. So that was the scientific basis. But there was also, let's face it, a real world basis. It was clear that healthcare facilities were under a strain because so many of their healthcare workers were either out with COVID or quarantining. Airlines couldn't function. We've all seen that reported extensively on television, and it even went over to collegiate and professional sports, games being canceled and altered. So actually it affected virtually every business, every university, every school. And so we had to do something to keep our entire economy, our society functional. And so the CDC walked a careful tight line, how to reduce the risk of transmission while allowing some restoration of social function. In effect, they were darned if they did and darned if they didn't, because nobody was completely happy. But I think they worked a careful line. And to summarize their somewhat complex recommendations, it's quarantine or isolate yourself for 5 days. Then, if you have no symptoms, and certainly if you have no fever, then you can transition, you can leave your quarantine or isolation if you wear a mask all the time for another 5 days. And that's, in my view, a reasonable way to go, although I must say there's been a lot of debate about that, and many people are not completely happy with it. Indeed, one of the questions that's been raised is, well, gee, we're increasingly having tests available. Why can't we, in effect, test our way out of quarantine? Couldn't a negative test allow you to leave quarantine and then not have to wear the mask is the implication? Well, there's some difficulties with that, and that's why the CDC didn't recommend it. A test result Yes, go ahead, please.
No, that was the question is, what role then can and should testing play?
Hmm. Well, most people would like a clear yes no answer from a test, but it's a little more complicated. Let me give you one example. The gold standard test, the PCR test, can, even after you completely get rid of the virus, remain positive in some people, even for weeks. Really? What does that mean? It means that test is so sensitive, it can detect remnants, leftover pieces of the virus. Think of them as dead soldiers. And that test can be positive for weeks. And so if you're relying on the PCR and you get continually positive tests, you would have to stay locked up in quarantine unreasonably because you're no longer a hazard to others. The rapid test can give you false negative results. Namely, if you still have a little bit of virus, that test is not sensitive enough to detect it. So it gives you a negative result, whereas you still have a little bit of virus with you. So you can see that the CDC said, well, you can use tests, but you have to interpret the results with care, and it's likely to lead to some confusion. We're going to have to muddy our way through this, is what I think, for a while.
And I think also notwithstanding the difficulty in obtaining tests in some areas of the country.
Exactly. And the fact that they are not freely available, at least not yet in abundance, means that there could be equity issues. That is, the better off of us can buy the tests and maybe get out of quarantine earlier than folks who are less advantaged and cannot afford the tests. That's not a good public health policy.
Absolutely. Bill, I can't thank you enough for your time and valuable insights. And as COVID-19 is continually changing, we'll look forward to a continued discussion on a future episode of the Schaffner Report. Thank you again for your time, Bill. We always appreciate it.
Thank you, Marla. We will undoubtedly have a reprise of this in the future.